I have enough experience. Allow me to welcome our presenter today, Dr. Regan Mbihi. Dr. Regan Mbihi has a vast experience in dental industry, having graduated from the University. With the interest in dental industry, Regan has gained knowledge in endodontics, restorative dentistry, crowns, veneers, and bridges. Currently, Dr. Regan Mbihi is a dentist. He's a resident dentist at Ngong Outpatient Center. And with the interest that he has have in dental industry, he has gained enough experience. Allow me to invite him, and before I invite him to start the presentation, kindly let's have these rules to guide us in the house. Rule number 1, kindly have your mics muted. And then rule number 2, in case you have any question, kindly write them down in the chat box. Dr. Regan will answer them at the end of the session. Karibu Daktari.
Thanks so much, Judy. So you let me know in case I drop out, in case I'm not audible enough. And also in case you can't see my slides, can kindly let me know so that I work on any hiccups on my end.
Okay.
So I will, yeah, that's okay. So I will now share the presentation. Today we'll talk about dental caries. So let me share the presentation with you. So Judy, you can just confirm that you can see the first page of the slide.
Yes, it's visible.
So in case the slide doesn't move or in case I drop out, you can also let me know. So thank you so much. So I'm Dr. Mbihi Regan, graduate of University of Nairobi. So I'll be sharing the presentation on dental caries today. And we'll start with the first slide today. So already you have a picture of some of the signs and symptoms that you might have when on the epidemiology, we'll classify caries, and then importantly, we'll identify the cause of caries, the signs and symptoms of caries. How do we diagnose caries? How can you also diagnose caries at home? How do we diagnose caries in the clinic? Also, how do we now manage the dental caries? And then lastly, we work on prevention and control. Now we are on the introduction page. So dental caries is an infectious microbiological disease of the calcified tissues of the teeth. So basically, it is characterized by demineralization of the inorganic portion and destruction of the organic substance of the tooth. So our tooth has both the organic and the inorganic components. So both the layers of the teeth, the enamel, the dentine, and the pulp. So we have the enamel and the dentine having both the organic and inorganic components. The organic component will be mainly the collagen type 1. The inorganic, that's where we have something called the hydroxyapatite crystals. So basically, this bacteria will be destroying both the organic and the inorganic components of the tooth. So it is the second most common cause of tooth loss. So that's why this presentation is very important. And it is found universally, irrespective of age, your sex, your class, religion, or any geographical locations. So the two most common causes of tooth loss we have the dental caries and periodontal disease or gum disease. We also have what you might feel, the signs and symptoms. So severe caries will cause pain and infection, which may now result in a tooth extraction, which is an adverse effect now when it comes to the dental caries. So it also affects the general health and the well-being of an individual, and is also a frequent cause of absenteeism at work or school. So we'll move on to the next slide. Judy, you can just confirm if you're with me on this. So who is
Yes.
at risk? If you're on the same page, okay. So who is at risk of developing caries? So sometimes we get parents, sometimes we get patients who ask, isn't my child too young to be coming for dental checkup? Isn't my child too young to be getting, let's say, dental fillings being done, pulpectomies or any other dental procedures? So basically, everyone is at risk of dental caries, and especially now the children and the adolescents. And here you'll find the diet plays a very big role. They snack a lot. The two groups that I've mentioned. Hygiene, not so keen on hygiene. So everyone will be at risk. Most at risk will be the children and the adolescents. Majority of dental caries will now occur on adults because the disease is now cumulative. So you've been having your permanent teeth since the age of around, you're getting from 6 to 40, and your hygiene hasn't been good, and the plaque control hasn't been good, you haven't been having regular checkups. So now the disease burden is cumulative. So by that period, over that period of time, you have quite a number of teeth being subjected to the dental decay. And there's a clear dose response relationship between the sugar consumption and dental caries. The higher you consume these sugars, the more you end up getting caries. Also, another relationship is also usually now in terms of plaque control. How well you're able to brush your teeth, how well you're able to maintain your oral hygiene. So the disease is also associated with the socioeconomic status, with high prevalence rates among the poor and the disadvantaged population groups who don't have access to good dental care, who don't have access to the mechanical plaque control methods like toothbrushes and let's say toothpaste. So everyone is at risk. And you now on the next slide, it's basically compounding what I've said in the previous slide. Almost half of the world's population is affected by dental caries, becoming the most prevalent of all health conditions. There's a sharp increase in disease activity in the industrialized countries in the first half of the 20th century, and it fell steadily due to widespread use of fluoride. So fluoride is important, and we'll discuss later in the prevention and control of dental caries. The prevalence in dental caries in the developing countries is increasing due to urbanization and the increased use of refined sugars. So these sugars are being broken down. And the sugars are now causing now the decay. In Kenya, the first national oral health survey of 2015 reported the prevalence of dental caries among 5-year-olds was 46.3%, 17.7% among 12-year-olds, and 34.3% among adults.
Sorry, Doc, kindly put back your video.
Okay?
That's okay.
Okay, so basically in the fifth slide, you can see now coming back to our country in Kenya, the survey reports caries prevalent among all groups. We even have now, in terms of that all groups, have something called early childhood caries. So the other name is baby bottle tooth decay or nursing caries or bottle caries. It's a type of decay that will affect the primary teeth of the young children. That's the milk teeth. So the milk teeth end up getting prolonged exposure to sugary liquids such as milk, formula, juice, any sweetened drinks, and it will now lead to the growth and the proliferation of the bacteria and the acid production in the mouth. So this acid is what will break down the teeth. Early childhood caries can occur when now the parents or the caregivers put the children to bed with a bottle filled with any sugary liquids. So the child going to bed with a bottle of milk, the child going to bed with a bottle containing any sugary liquids, the formula, any juice, any sweetened drinks, eventually will cause decay in the baby teeth. So if left untreated, this will now lead to pain, this will lead to infection, this will lead to damage of the teeth, and I'll share a picture in the next slide. And it will also affect now the child's ability to chew, speak, develop oral health habits. It will also lead to now pain, any infection, as I mentioned. So the prevention will basically involve limiting the intake of sugar fluids, We encourage proper oral hygiene habits from a young age. We encourage even parents and the caregivers to be cleaning the child's teeth as soon as the first tooth comes into the mouth. And in terms of the dental side, this will involve treatments which now have the cavities being filled. You have the extraction of the severely decayed teeth. And in some cases, we have things called stainless steel crowns that we use to protect and preserve the remaining teeth. Just a moment. So that's an image. If you can see, that's a child still have the milk teeth in place, and you can see the decay. Also on the image on the right, you can see what happens when the bottle rests in the mouth. So the tongue pushes it to the upper teeth, the palate. So the suction is created, and that sugary fluid is left on the teeth the entire period. The entire night, we'll be having contact between the tooth and the sugary fluids, and the bacteria will now destroy the teeth by producing the acids. So now here we'll come to the classification. How do we classify dental caries? So we can classify dental caries depending on the location of the caries. Is it in the pits and the fissures? Is it in the smooth surfaces of the teeth? Is it on the root? That's now where we get the cemental or the root caries. And is it also recurrent caries? We can also classify caries based on the rate of attack. We have rampant or acute caries, rapidly spreading caries. We have the slowly progressive or the chronic caries. We have arrested caries. Arrested caries is basically has stopped progression. There's no longer active disease in the tooth. So that is now depending on the rate of attack. So the etiology, what will cause your tooth to get the cavities, the decay? So number one, you have the carcinogenic bacteria. And over here, in terms of the carcinogenic bacteria, mostly the bacteria associated at the streptococci group, the strep mutans, you have the lactobacilli. So basically, you have the bacteria that will now destroy the teeth. We have our susceptible tooth surface. So that is the area where the food is stagnating. That's where the area where the food, the diet is now packing inside the tooth. We have now the substrate, the food itself, the sugary diet. Then we have time. So that all these three factors left on the tooth for an adequate amount of time will now lead to the decay. Hence, the reason why we recommend you brush twice a day to eliminate that fourth component of time. So the bacteria isn't left to act on the tooth and destroy the tooth substance. So also basically what I've talked about, it's now in terms of the free sugars. So those sugars, you can see the images, mostly in snacking. So the sugars will now be destroyed, will now be acted upon by the bacteria. The bacteria will metabolize those sugars. The bacteria will now produce an acid. And this lactic acid is what will now demineralize the hard tissues of the teeth. That is the enamel and the dentin. So we are very, very keen on people who have a high intake of free sugars, and these people will tend to have more dental caries. So in many countries, we have these sweetened sugars, the sweetened beverages. We have including the fruit-based and the milk-based sweetened drinks, and 100% of the fruit juices are a primary source of the free sugars. So we also have other common sources: the cakes, the biscuits, the sweetened cereals, the desserts. All that will now increase your chances of getting decay. So how can you know you have decay? What are the signs you'll see even before visiting the dental clinic? What are some of the symptoms and the signs that you'll have? So the first point is very crucial. The early stages are often without symptoms. So hence the need to have your biannual checks. Sometimes you may think you don't have any decay, but it's only because it's in the early stages where you don't have the cavitation yet, you don't have any symptoms. So early stages are without symptoms, and that is when the bacteria and the acids are being produced, eating away the top layer of the tooth. So mostly we'll get to the symptom part in the advanced stages, where now the lactic acid, the acids will be penetrating into the deeper layers of the tooth. That's now the dentin and the pulp. So one of the signs you can see at home is maybe now that point you see a cavitation, a hole in the tooth. The other thing you might see is now the tooth, you see the tooth is weaker, the tooth is chipping. the tooth is breaking off, that's a sign you might have a cavity. What are some of the symptoms you might be having at that point? The images also illustrate that you might have sensitivity, you might have pain, the severity will range. You might have now an infection, as you can see in the images below. And this infection, if left untreated, can now be even potentially life-threatening, where you have cellulitis, as depicted in the other images, where you have something called Ludwig's angina, where now the infection will penetrate into the submandibular and submental spaces, and you end up now obstructing your airway. So you can see the lady on the far right. So that's all because of the decay in the bacteria and the infection now progressing when left untreated. Also, when you're immunocompromised, this will also increase the risk of developing the potentially fatal outcomes of dental decay. So the image illustrates just basically what you might see, what you also see in the clinic. Any tooth, you can see the front tooth, you can see the back teeth, the molars, the premolars, any surface is susceptible to getting decay. As you can see, as small as the lower right one, as huge as the upper left one. So in different stages of progression. So as I mentioned in the early stages, you might not have any symptoms. As you can see in the lower right image, that patient basically doesn't have any symptoms at the moment, as compared to the one in the upper images. So biannual checkups are very crucial. So you can identify such cavities early, and you get treatment before you develop any of the signs listed in the previous slide, before you develop any potentially life-threatening condition. Also, in the diagnosis of dental caries, now this mostly applies when you come to the dental clinic. So how do we diagnose dental caries in the dental clinic? Number one is a detailed history from the patient. So the patient will come in and present, before you even do the checkup or the clinical examination, some things we can pick out from the history. How good is the patient's hygiene? How often do they visit the dental clinic? How is their diet history like? So also in terms of now the symptoms, a patient might say, I haven't slept last night due to pain, already points to something happening in the teeth. A detailed history, I had a swelling last week, or I currently have a swelling. So some of the things that we pick when it comes to the diagnosis. After the history, then we go into the clinical examination. In the clinical examination, as depicted in the previous images, we might see now the cavitations during the clinical examination. Any abscess will be noted, any swelling, and in such a case where we have an abscess, we usually recommend we put you on an antibiotic therapy first, so that we're able to manage the infection and stop the progression of the infection. So that's another clinical examination. We'll check all the teeth. The lower left image is something called an explorer that we just use to check on the cavitations of the teeth. Number three, now we go into the investigation part. We have things like the pulp vitality testing. Then we have the radiographic examination. So the other image you're seeing is now a dental X-ray. That's called a biting. And in the biting, we're able to see some black areas on the teeth. So basically, we use the radiographic examination to check how. Sorry. Okay. So basically, we use the radiographic examination to check on the teeth affected. The radiograph will also show us how deep the decay is, which is very crucial. The radiograph will also show us how many teeth are affected. The radiograph can also help us diagnose carious lesions that are not yet visible. So some of these carious lesions, most of them actually are starting in between the teeth. So it is very easy to diagnose caries occurring on top, on the occlusal surfaces, the biting surfaces of the teeth. In between the teeth, you can see the radiograph on the right depicts it very clearly. So we use the radiographic investigations when it comes to the diagnosis of dental caries. So we'll now move on to the management of dental caries. How do we manage dental caries? Once you have now diagnosed you have the dental caries, how do we manage? You have the non-operative phase, the operative phase. We now have the extraction, also in part of management. Last resort when it comes to the management of dental caries. So in the non-operative phase, basically we are treating the early caries lesions. So basically no active treatment is being done on the tip. So it's the early phases of treatment, or the early phases of the caries lesions. There's no cavitation yet in the tip. So basically this just involves the assessment and modification of the risk factors. And it will include a couple of strategies. The mechanical plaque control, that's where now the toothbrush comes in. That's where we recommend you do use the floss to clean in between the teeth as depicted in the image. That's where the fluoride use comes in. Also, we have fluoride in the toothpaste. We also have professional fluoride application, which we usually do in the clinic once you come for your dental checkups. In the early phases, you also modify your diet. Are you snacking a lot? Are you having a high intake of the sugary foods that I mentioned? So you're able to modify your diet so that you don't end up getting more breakdown of the tooth surface, no cavitations. So that's where the diet chart comes in. That's where the diet counseling comes in, especially for the children. People who have a condition called xerostomia. Xerostomia, basically there's reduced salivary flow. So saliva is very crucial in terms of the prevention of dental caries. So we can give the sugar-free chewing gum, we can give xylitol, can give anything to improve now the salivary flow when it comes to the non-operative treatment of dental caries. Basically now we move on to the operative phase, and here we're involving now the dental team. There's active use of now the dental equipment when it comes to the removal of all caries. So we remove caries. You can see an image where the caries has been removed. Once that has been removed, then it has been replaced using a dental material. You can see it is very aesthetically pleasing. No left of the tooth surfaces. The appearance is back to normal. We're able to stop the incidence of pain, sensitivity, and all the other symptoms. So that is on the operative phase of treatment. On the operative phase of treatment, we want to improve the appearance, we want to improve the form, we want to improve the function. You basically want to use your teeth to chew, you want to lose your teeth. So that is on the operative treatment phase of dental caries. That's where the dental team now comes in. Extraction is usually a last resort. So in the operative phase, allow me to go back to the previous slide. So you have cases where the tooth still has enough structure. It can't be saved by using the composite. It is quite deep maltreatment that now involves removing of the bacteria, cleaning out the pulp area of the tooth, and then restoring the tooth back to the proper appearance, the proper form, and restoring the function of the tooth. That is now the root canal phase. Sometimes now the patient presents when the tooth structure has been completely destroyed. So in such a case, now we go to the extraction phase. So usually considered as the last option when the tooth cannot be saved. So the indications for extraction of the carious teeth are listed. So number one, the tooth cannot be restored due to extensive damage. Number two, basically you've come in too late when the tooth has already been destroyed. The crown portion is barely there, so nothing can hold the restoration. So that is the number one phase. Number two, teeth that are not of strategic importance. So basically, this one we usually talk about the last molars. We talk about the last molars in terms of strategic importance. We talk about the last molars in terms of something called impactions. Sometimes due to lack of space, the teeth end up getting impacted. So such teeth are not of strategic importance, so we end up doing the extractions. Lesions in an area where we have difficult accessibility for the operative intervention, like the distal aspects of the third molars again. And then a tooth with a poor prognosis, let's say the tooth that is barely hanging on. Let's say you also have, on top of the dental caries, you also have severe periodontal disease or gum disease. The tooth is basically mobile. So the prognosis of that tooth, even with the restoration, you have extensive bone loss, but you don't have any support of such a tooth. So you end up getting now the extraction being indicated in such a case. But ideally, we want to diagnose such dental lesions very early so that we end up avoiding extraction because as you know, extractions will come with other things later. So other consequences of extraction, there's instant relief basically, but later you'll have, depending on also how many extractions you're getting done, you'll have some trouble when it comes to feeding. Basically, you'll have an issue with appearance, especially on the front teeth. So that's why we try and avoid and consider extraction as a last option when it comes to management of dental caries. So what happens now in cases of untreated caries? So the patient, let's say, doesn't have access to dental treatment or chooses not to have the caries managed through any of the measures I indicated in the previous slides. So that's where you have things like abscesses coming in, basically the infections. And the infections can now progress into cellulitis, the facial space infections. You've seen an image previously with a child where even the intrabuccal region, the eye region, you've seen an image where someone has the neck being swollen, and that is now the infection in the facial spaces. Now that's where the Ludwig's angina comes in. Chronic infection will also lead to things like periapical granulomas. So basically, untreated dental caries doesn't just end there. Untreated dental caries has other risks involved with it. Now that's where the abscesses come in, the infections come in. So the infection from the tooth will basically lead to all that. Usually say prevention is better. I usually prefer prevention is better than cure. So in the prevention phase, that's where we have the interventions. We have medical interventions in the clinic. We have other interventions outside the clinic. So when it comes to the interventions, we recommend the use of systemic and topical fluorides. So in the strengthening of the enamel of the tooth, we have something called pit and fissure sealants. So the occlusal surfaces of the teeth, the biting areas of the teeth can be sealed in case we note, this is now the prevention bit, we note the child, the adults, mostly now it's really the first molars of the children. The molars have deep pits. They have areas where now the food is catching, the food is getting stuck. Cleaning is becoming an issue in such areas, and you don't want to give the bacteria enough time to act in the teeth. There's something we put called a pit and fissure sealant to prevent that area from becoming deep and causing the caries later on. We have preventive restorations. We have different types of restorations. Those are the fillings, basically. Prevention, we recommend regular dental checkups. We say at least you have biannual checkups, that is twice a year. We space them every 6 months. You have a dental checkups done. And you remember I mentioned early stages of decay are usually not symptomatic. They usually are symptomatic. So basically, regular checkups will help us pick out such caries lesions early enough, and then we act on them before we end up progressing to deeper cavities, to pain, root canal, or even extraction of a tooth. So on the non-medical interventions, basically you have oral health education. We also usually encourage even the parents when they come to the clinic, tag along your child when you come to the dental clinic. They end up getting familiar with the dental clinic on how important it is to brush twice a day. So it's not only coming from the parents, also coming from the dental practitioners and the dental team. That's where we work on the nutrition and the diet, where the sugary foods are being discouraged. We discourage the snacking. We'll be encouraging the children to be, even the adults, you'd rather have the fruits, the apples, the bananas than having your chocolate during your snack break. We also improve the methods of maintaining oral hygiene. We do use and recommend the use of fluoride toothpaste and toothbrush. We recommend the use of dental floss or any interdental brushes to clean in between the teeth. So as I mentioned before, as you saw in the image, the radiograph image, so the decay can start in between the teeth. So that's why we're having the flossing being encouraged. And we even encourage that more. We're nowadays even discouraging the use of toothpicks when it comes to the interdental cleaning. So we recommend if you don't have a floss, can you get one? You can floss at least once daily to maintain proper hygiene. It aids your toothbrush in the toothbrush is unable to clean. We have the mouthwash, and then in the brackets there you have seen under prescriptions. So we usually don't recommend you use a mouthwash 30 days of the month, continuous mouthwash use, unless prescribed. So this is just occasional mouthwash use. Other interventions generally is now to make oral health care more accessible. Get the information out there, like through the webinars that we're having, through any outreach programs. We do visit schools, we do visit churches to try and educate people on the importance of oral hygiene. We also try and make oral health care more accessible, more dental clinics, more teachers, try and make it more affordable, so people are able to manage dental caries as opposed to only resorting to extractions. So we also improve the socioeconomic and literacy levels of the populations. We also include oral health care in the general health insurance. So we are pushing towards the inclusion of dental cover when it comes to the medical cover and the medical insurance schemes, so that more people are able to seek and access accessible and affordable dental treatment. So we're really trying to avoid the extraction phase of treatment. Apologies for the font, but basically this is everything I have just mentioned before. Just a detailed explanation in the same. The use of fluoride, the topical use, the physical methods where we have the brushing in the dental clinic, chemical methods. That's where the toothpaste comes in. That's where the mouth rinses come in, and also we modify now the diet. So the chart over here that shows that depicts how often you should brush. So that is brush twice a day. You can see number one is on, basically we're insisting on all the tooth surfaces, and lastly the tongue. So you can see number one is on the outside surfaces of the teeth. The inside surfaces of the teeth, that's where we usually have most issues, most accumulation of plaque, calculus, the inside surfaces. Because visibility is a bit poor, you can't see that unless you're very keen on your mirror, so people end up missing the inside areas of the teeth. The molars are usually more affected, so brush way in the back. Children tend to brush the front teeth because that's what they can see. So we're recommending you brush even way in the back, even behind the front teeth. And then lastly, you can see the tongue. So also do brush your tongue. A lot of plaque does accumulate in the tongue. The tongue is a huge source of halitosis, which is basically bad breath. So as you brush your teeth, can you remember to also brush your tongue? I'll show a video. I hope to be able to play so that you can also be able to see how the technique that you should use when you're brushing your teeth. The other image depicts the healthy foods. Basically, healthy foods will now point to healthy teeth. So choose healthy snacks, avoid the sweets, limit the intake of sugary foods, the sticky foods, the chocolates, limit the intake of that category of sugary foods. We choose the healthy snacks. The images are there, you've seen the fruits. So I will try, let me see if I'll be able to share a video depicting the brushing technique. Judy, kindly, you can also kindly let me know if you're able to see the video.
Yes, it's in.
Okay, so basically I'll just move to the point where, so this just illustrates the best practices. Floss first before brushing, and then you floss for months. Also, as soon as the bristles are no longer straight, we do recommend you replace your brush. So you don't have to wait for the 3-4 months. You can replace your brush as soon as the bristles are no longer straight. So that's the best practice when it comes to that. So Judy, you can also confirm you can see the video.
Yes, the video is visible.
So basically, you can see the motion that lady is using to brush her teeth. It's called modified burst technique, and you can note she is moving her brush in circular motion.
More superficial than other brushing techniques, regardless of the brushing technique used.
So as you can see, she's brushing in circular motions. We do recommend circular motions. Your method natumia kama una scrub nguo, let's say when you're cleaning your clothes. So we do recommend the circular motion. In the circular motion, you're covering at least 3 to 4 teeth at a time, as opposed to the scrub method where you're using a long stroke to cover all the teeth. So the scrub method is not recommended because you end up now causing damage to your gums. You end up causing damage to your teeth. Your teeth will now cavitate, will now have lesions on the border of the tooth and the gum. So we do recommend the circular motions, quite gentle on the teeth. And you'll also note your teeth, your gums are in a semicircular shape, the scalloped. So your gums are not flat. So that semicircular motion also just goes in line with the anatomical variation of now the gums. So the circular motion is recommended. You can see it's a few teeth at a time. Nothing too vigorous. There are those who brush and you can hear them from another room or a few meters away. So nothing vigorous. You take your time. We do recommend you take 2 minutes when it comes to brushing. So I'll continue sharing the video.
It is essential to teach patients
So
to
just
brush
try
all
and see the
surfaces
circular
of their
motions.
facial and occlusal and incisal. Brushing in a systematic pattern, for example.
So basically, they've just depicted all the areas of the teeth that should be brushed. Basically, it's the inside, the outside, and also on the occlusal surfaces of the teeth. Basically, that was the main point of this video, just to see the circular motions when it comes to brushing.
Health professionals recommend brushing techniques.
So this has been shown to be the most effective, one of the most effective techniques when it comes to brushing. So you floss before once you have flossed, you now take your toothpaste, put it on the toothbrush. Not a huge amount. Don't smear the whole toothbrush with the toothpaste. A pea-sized amount of toothpaste is enough. Then you're able to brush all the surfaces. We do recommend you do that twice a day. We do recommend you take 2 minutes when it comes to brushing, and you're able to access all the areas of the teeth, the back teeth, the inside surfaces of the teeth. All that can be accessed when it comes to the brushing. So, and then now we have the other measures. We're still under prevention. That's where the toothbrushing technique comes in. Other measures can come in when it comes to the prevention of dental decay. Number one is prevention of malocclusion or correcting malocclusion. So you might have crowding of your teeth, and that will pose a challenge when it comes to cleaning. You're not able to access all the surfaces adequately when it comes to brushing. So we might correct the malocclusion so that your surfaces of the teeth, besides correcting your appearance, you're able to access all the areas of your teeth nicely when it comes to the toothbrushing. We also work to prevent the premature loss of deciduous teeth, those are the milk teeth, which early loss of milk teeth will now lead to now the malocclusion. And we'll also work on the restoration of missing permanent teeth. We have things like dentures that are used. We have the crowns and bridge. You have implants. We want to restore your missing teeth. The other measures are now the use. We usually now recommendation of the sugar-free chewing gum, which is now freely available and affordable in the country, as opposed to the other chewing gum which has too much sugar, which will be broken down by the bacteria into the acids. We have other sugar substitutes that are being proposed, like the xylitols and mannitols, for use in the pediatric syrups, the syrups that you're giving to the children and in the confectionery. The other thing is now to make toothbrushes and the fluoridated toothpaste available to the masses at a low cost. So these are some of the measures that we are now pushing to prevention of dental caries. And you can see most people will ask, do we use fluoridated toothpaste or do we not use fluoridated toothpaste? You can see the last point basically shows the regular use of fluoridated toothpaste is proven to reduce the incidence of caries by 30%. So that's quite a huge percentage when it comes to the prevention. Some of the challenges now that will be posed in the prevention of dental caries will be the disproportionately affects the poor and the disadvantaged populations, which have lower access to the prevention and care methods that we listed before in the other slides. Often dental caries do not receive the adequate priority in health planning due to the underestimation of the true burden and the impact of the disease. So the focus on interventions is generally characterized by isolated disease approach and a focus on costly clinical treatment rather than an integrated, cost-effective public health strategies. So basically, that point basically says nowadays most both in terms of the organizations, both in terms of us as individuals, will tend to go to the clinic for treatment rather than work on the prevention measures, and treatment will tend to be costly as opposed to now the prevention measures. Will go to the clinic and focus on the tooth that is causing issues. So the dentist will be advising on cleanup. The dentist will be advising that you do fill those early caries lesions. But now, if we do focus on only the main concern, we end up leaving the other teeth. So basically, you end up getting a higher disease burden, and the cost will eventually be high. So prevention is usually better. Early detection is better and cheaper than when it comes to now the late treatment of dental caries. And also the cost is also now in terms of losing your tooth. Also now incurring when it comes to that time cost. Root canal will be told you have to go for a couple of appointments. So we'll be focusing on the treatment first, as opposed to the management, which might now be more costly. So basically, as in line with that, we have as AAR, we have a couple of facilities that are ready to offer dental treatment, dental checkups. If you haven't had your dental checkup this year, we do recommend you can access any of our 18 clinics countrywide. The number is still growing, but at least now we're having 18 dental facilities. They're listed on the slide. So we do recommend you have your checkups at least every 6 months, at least twice a year, have a dental checkup, and you've seen the importance of that. You're able to diagnose early lesions early. And I mentioned early lesions might not be symptomatic. So don't wait and get to the symptomatic point where you're having the pain, the infections, the swellings. Visit any of the facilities and you'll be able to be assisted. For more information, there are numbers listed on the slide. Basically, that's it. Thank you so much for being with us today. I will go back to the moderator. The moderator can now also inform me in case there's anything she might want me to clarify or anything she might want me to add, and then I will take questions.
Thank you so much, Dr. Regan, for such a pleasant presentation. We have a few questions here. I don't know how you'd like it. Would you like a question and answer, or I read for you the questions and then answer at once?
Okay. So you can read the questions. You can read two, and then I answer, and then we get more.
All right. Before I read the questions on the chat box, there's someone who raised their hand. Kindly unmute your mic and ask the question. In case we lost her, the questions we're having here, the first question we have from Evelyn Kundu. Evelyn is asking, what is the relationship between? The second question we're having is from Dorothy Mogai. Where are your dental clinics located and what's the consultation fee?
Okay, Judy, I can tackle the first two questions first. So on the first question was in terms of the relationship of the nursing bottle and dental caries. So I'll just take you back to the slide. you able to see my slide, Judy?
Yes, yes.
Yes, so basically we said what we need to, the etiological factors, the causes of decay are usually now the tooth substance being there, the bacteria, the food, the carcinogenic food, and then time. So basically, as you can see in the image, those are milk teeth that are affected by dental caries. And in the other image, you can see a child sleeping peacefully with a bottle in the mouth, presumably containing milk. So that milk still has sugars. Some parents do put sugary drinks, some do put juice. So any sugars, so that bottle will be left. The child, it is so soothing, the child will sleep with the bottle in the mouth. So now we're having the fourth component coming in, time. So that bottle will be there the entire night, acting on the teeth. That milk, those sugars will be there on the tooth the entire night. So you're having a lot of time, a lot of contact between the sugars and the tooth surface. And now with that, the bacteria will now come in and act on that, act on the sugars, which are readily available throughout the night, and then start producing the lactic acid. Then that acid will now destroy the tooth surfaces, both the enamel, go into the dentine, and eventually the pulp. And then that can now eventually now even lead to the other things like infections when it comes to the dental decay. So basically, that's what happens. The relationship is the bottle still has milk. The milk does contain sugars. Those sugars will be broken down into acid, and the acid will destroy the teeth. Someone asked, where are the clinics located? How much is the consultation fee when it comes to that? So the image, the slide I've shared contains our clinics currently available countrywide. For more information, you have two contacts displayed. You also have the website where you can get more information and more help when it comes to that. So consultation fee usually varies depending on the insurance provider that you have. So it will range from 1,000 shillings to 2,000 shillings when it comes to the dental consultation, depending on your insurance provider. Dental consultation usually is valid for 3 months. So you are doing your treatment, you're doing your fillings, you have quite a number. You don't have to pay consultation today. When you come to do your 2 fillings, then pay consultation tomorrow. No, it's usually valid for a period of time. So when you come in for the consultation and you pay a consultation fee, it covers it for a period of time when you're able to complete your treatment. So those are the facilities. That is now the information when it comes to the consultation, and now that's the information when it comes to
Thank you
the
so much.
consultation fee.
Thank you so much, Evelyn and Dorothy. I believe you're well answered. The next question we are having is from Felix Wangulu. And the question is, we have many brands of toothpaste in the market, some attached to the charcoal name. Which one would you recommend, and what's the recommended fluoride concentration?
So we will recommend fluoridated toothpaste. We have different age groups also when it comes to now the recommendations of toothpaste. So you'll see in the supermarkets, in the pharmacies, and the chemists around, you'll see you have toothpaste that has a label of the age. So that toothpaste with the label of the age, you can see 3 years, 2 years, that toothpaste basically has less fluoride. So that one is basically for the children, so that they don't end up getting fluorosis. Basically, too high concentrations of fluoride will lead to something called fluorosis, where it is rampant. It is mostly in this, let's say, Kajiado areas where you see people with brown teeth. So basically, we recommend for the children, you get the age-specific toothpaste. They have the adequate amount of fluoride that is recommended. For the adults, we do recommend you also still use fluoridated toothpaste. So number one is the fluoridated use of toothpaste, whether charcoal or not. The charcoal effect has not yet been proven to be causing whitening of the teeth, but our main concern here is dental caries. So I'll just stick to my dental caries side for now. So the fluoridated part is the part that you want you to focus on. Does it have fluoride or not? The adequate amount indicators when it comes to that. They usually say that around 1,500 parts per million of fluoride, but all those are usually left now to the people who now make these toothpastes. So we'll have that being sorted by them. So you just make sure you have fluoridated toothpaste. Make sure your children are using the age-specific toothpaste so they don't have too much fluoride when it comes to that.
Thank
So,
you. Malusi, I can
Judy,
see you raised your hand. Kindly ask your question. Malusi?
Lincoln Malusi, you can pose your question.
Good evening, all.
Good evening.
I would like to ask, what's the role of fluoride containing? What's
Sorry?
the role of fluoride containing toothpaste in high fluoride areas like, let's say, Kajiado, since the whole point of fluoride containing dentifrices was to raise the fluoride. Since what's the role of fluoride containing toothpaste in high fluoride containing areas? Since the whole point of fluoride containing dentifrices was to raise fluoride in areas where there was insufficient fluoride in water and diet generally.
That's one. Any other? Judy?
Doc, maybe you can answer that one.
So fluoride is usually crucial in the prevention of tooth decay. It makes the enamel less permeable, more resistant to now the decay when it comes to that. So the role of basically that is topical fluoride. So we have now the topical and the systemic fluoride. So people in the areas you listed, let's say Kajiado, are mainly posed to the systemic fluoride. So they end up drinking water which has too much fluoride. So that will in turn now cause the fluorosis and the effects on the teeth. So fluoride is still required in terms of the prevention. So this fluoride in the dentifrices is topical. It will be acting on the tooth surfaces. So the fluoride in the toothpaste the health of the tooth in the prevention and the strengthening of the enamel structure of the tooth. So that is now topical. The other one is systemic. So topical is still recommended in the prevention of dental caries. So the other one in the endemic areas is systemic, that's in the water. And that mainly now affects the children. That's another topic, but that will be affecting the children when the teeth are now in the formative phases. So, but this other one is now in the topical prevention. So this one won't cause fluorosis. The topical application, that's why now the adults won't get fluorosis regardless of how much toothpaste they'll be using, because it is just topical on the teeth. So it is not systemic. So usually very worried when it comes to systemic use of the systemic concentration of fluoride. The topical concentration, that one is usually not a major concern when it comes to that. So the main point is now the topical. That is just topical application of the fluoride. Judy. You can see Rebecca, Philip.
Lucy managed to get the answer right. However, we also have Rebecca raising her hand. Rebecca, kindly go ahead.
Good evening, everyone. I think the dentist I saw and the knowledge that I was given is that the bone water affects our even unborn children, and if they take it,
Rebecca, we can't hear you. We can't hear you well.
Yeah, can you repeat?
Can you hear me now?
Yes, I can.
Yes, please.
I'm saying,
Okay.
yeah, there's a time I saw a dentist and she first 1 year after birth. So my question is, what is the way forward? Is there any solution for that?
Yeah, so basically, let me answer that. When it comes to the tooth formation, usually say the first stage of formation actually begins 6 weeks intrauterine. So that's when the still in the womb, 6 weeks in, that's when now the tooth formation early stages will be forming. So that's why eventually now we also do recommend also the mother to take care when it comes to the ingestion of fluoride or the fluoridated water. So it's 6 weeks into uterine, and the formation will continue until the child is born. Then the teeth will now be in the mouth from around the age of 6 months. So when a child is 6 months old, the teeth are now popping into the oral cavity. But the formation already began a while back. So what you're seeing is the product of the formation. So the formation began a while back when you had too much fluoride in your system. And then eventually the formation will keep on occurring, the teeth will keep on erupting into the oral cavity. So we still recommend care in terms of the parents. We still do recommend care in terms of the children. Also that baby, through those stages of tooth formation, as also they will be shedding their milk teeth all the way till the age of around 12, 13. That's when they'll be done with the shedding of the milk teeth. So throughout that stage, they are highly susceptible to fluorosis. So that's another topic, that is now fluorosis. So you've mentioned another challenge, which is now the borehole water. So initially we used to say fluorosis is endemic to a particular region, let's say Kajiado, due to the minerals in that area, the water in that area containing too much fluoride. But nowadays with our high rising floods, even in, let's say in all areas of the country, we end up digging boreholes. And then you'll find the concentration of the fluoride in the boreholes will be quite high, as opposed to fresh water. So the measures usually recommend when it comes to that is number one, water in the drinking water. Drinking is the number one source of the fluorosis. So drinking water, get the age-specific toothpaste for your child. We do recommend you can get something called a filter installed. So the filter will now help in reducing the amount of fluoride. You can get your water tested at any facility. You get to know what is the concentration of the fluoride, if it's within the adequate amounts. So basically, these are some of the measures. So formation will occur with too much fluoride in the body, and then that will cause the fluorosis. So we do recommend you take the measures in preventing that.
Thank you so much, Dr. Regan, for that presentation and even answering the questions. In the interest of time, I'm only going to read 2 comments here. One is from Collins Casiero. He's saying, very great presentation, sir, thanks. The other one is from Chris Adede. Chris is saying, great presentation by Dr. Regan. So ladies and gentlemen, I would like to appreciate you creating time to attend this webinar. I know because of time, we were not able to answer all the questions. And for more information, for more questions, for more clarifications, kindly visit our dental clinics. All our PCs have dental clinics. They've been moved closer to you. There you as you, and have a good night. Thank you so much for presenting, for attending. I was your moderator, Judy Oluwach, and our presenter for today was Regan Mbihi. Thank you so much.
Thank you so much. Feel free to reach us at any of the facilities listed. Have a good night.